and do the best I can. And I think I had a few other people had similar questions about how to kind of activate the low abs. So let's actually do it next. We'll do a little bit of kind of activation of those deep abdominal muscles. If you didn't do an activation of the pelvic floor, as I was saying, those cues of squeezing the openings, remember the openings. We have some openings from this direction. We have some openings from this direction. We put on our little external muscles and sphincters, and we have the openings even better pictured. But remember, try it right now. If you didn't already, squeeze your openings, squeeze off your openings, close off your openings and lift. That's a great cue. And then release the openings, let it all flow out. Okay, so that's a cue. Or you can also think of squeeze your anus. That's going to get that real big broad expanse, that global expanse of pelvic floor muscles. Okay, so the next thing that I thought would be fun to do would be to talk more about activating the lower abs. The second question that I'm answering again is for a woman who is 4.5 months postpartum, had a C-section. So there's going to be a disruption for sure of the core muscles, the deep abdominal muscles, because of the surgery. Thank goodness for surgeries, but sometimes they can disrupt our muscles. Sometimes we absolutely need them, and we're so grateful for them, but it does require some care in healing. She's saying that she's wanting to learn how to engage her transversus abdominis better with gentle breathing and how to incorporate pelvic floor exercises each day without overdoing it. So like I said, there's a lot there to unpack, but let's just talk about how to engage your deep abdominals better. So one way you can do it is, like I said, so we have that feeling of where our pelvic floor muscles are, right? Obviously, we've just gone over that for quite a while. So we know where our pelvic floor muscles are, and now, of course, I'm standing up with my pelvis this way. Okay? So the pelvic floor muscles are at the bottom like a little hammock. You can think of your TVA as like a corset that goes around like this. So they go around like this. You have on top of the TVA, the transversus abdominis, you have some oblique muscles. You have your obliques, the internal obliques and the external obliques. And then on top of all that, you have your rectus abdominis, your six-pack muscles. So let's focus first on that deepest level, or actually let's focus only on that deepest level, which is the TVA. So the TVA is that deep band. It goes around, it hooks into this connective tissue line in the middle. So it's this aponeurosis, it's connective tissue. They hook in, and they also hook all the way around to your back. So they hook into connective tissue in the front and the back, so they literally are a corset that goes all the way around. And probably my favorite way to just kind of activate them is to put your hands around your waist like this and cough. Just do a and you can feel the abdominal kind of pull in as you do that. So hopefully you're trying it if you're watching it right now. Just a little. Now, when you do that, you're actually going to get kind of a sense of those muscles contracting, but you're also going to get a sense of how you can engage those muscles when you're breathing. So sometimes, and this is such a great starter exercise, is just simply breathing. It's so easy, but just simply breathing. Even though it might not seem easy or simple at first for some people, because a lot of us breathe in a way that maybe isn't the best for our bodies. We might breathe really high into our chest, or in some other, I hate to say it, the word dysfunctional makes me sad, but it is considered kind of a dysfunctional breathing pattern if you're breathing really high up into your chest, or breathing that's in a way that's different from what I'm going to tell you right now. So what you want to do is, when you inhale, you want to feel that your ribs gently expand, because we're making room for our lungs to get bigger. So our ribs gently expand all the way around, and then the pressure increases in our abdomen a bit. And then when you exhale, the lungs get smaller as the air goes out. So the lungs are literally getting smaller, shriveling up like little, shriveled up things. And the diaphragm goes up just a bit, it changes shape, and the belly comes in just a little bit, partially because of the change in pressure, but also that exhale can activate that TVA, those deep abs. So when you do an inhale, everything expands, and then when you exhale, it pulls in. And it's the same muscles that you felt when you did that and you felt your waist. So I mean, there's more than just that. There's all of the ab muscles are working, but those deep abs, and if you think of the anatomy of what it looks like a corset all the way around, you know, where my fingers are right now, the fiber is going this way. Whereas the obliques, the fibers go up and down for the internal and external obliques, but these fibers go this way. Okay, so we're thinking about that the kind of the function of these abs is to compress. So they compress everything. They have more functions than that, but that's one of their big ones. They keep everything pulled in so they can help with that mummy tummy. Now, you know, I'm going to quickly address one more question about addressing oblique dominance. She says, I think it's causing my tummy to pooch even more. My pelvic floor PT says I don't have diastasis recti, which is the split in the rectus abdominal. Well, it's a separation of the anterior abdominal muscles, the rectus abdominis, because of a lengthening and a separation and a stretching essentially of the connective tissue that's underneath. So that's what diastasis recti is. Also called diastasis recti, depending on where you live in the world, by the way. So she's saying that she may have oblique dominance. Now, I find that oblique dominance or upper ab, so dominance of these upper ab muscles can really happen, especially there's many reasons for this, but if we're not used to zipping up or engaging pelvic floor first, when we do our ab work, whatever ab work we're doing, we often come to these more upper muscles rather than our low TVA and our pelvic floor. So that's why I'm always talking about pelvic floor first and zipping up your core. That's what I mean. I mean to start your engaged core down low and then zipping up. And, you know, making sure that you're really secure from down low. That's going to help activate that pelvic floor and TVA and prevent a dominance of these upper ab muscles, which can, when they're really tight up here, and we've got those obliques really firing and turning on there, they can turn on a little bit too much, and they can push downward. So you picture like a pushing downward, like blah, like squeezing a toothpaste tube from the top. When the cap isn't on, all of the internal organs and you know, the toothpaste is going to come out. I've done this demonstration before, so you might have seen me do it before, but that's what can happen if you have dominance of really any of these upper abs and you're not engaged from below. So I think that's all I'm going to say about it right now, because I feel like I've been talking a lot and I want to actually just see if there's more questions that have come up.